I think if you have the support of an admin team, it really helps guide that collaboration with the surgeon, because we're in partnership. As an anesthesia practice management company, we're in partnership. We are not the only team. We cannot do anesthesia without having surgeons, right? You can't do anesthesia outside of a hospital or a surgery center or anything like that. But an administrative team really impacts that and how things move forward too. So having a strong relationship with your administrative team, with your chief nursing officer, your chief medical officer, the CEO and the COO, it's incredibly important. Medicine should be run by providers, right? It shouldn't really be run by a software system alone, but it's nice to have the support of the technology along with the clinical care that a provider can give as well.
Leveraging technology to help enhance your practice. So those clinical indicators and the warnings, that will help drive, hopefully, positive patient outcomes and ensure that, we're not missing anything, or at least the clinicians are not missing anything. And then also speaking to just charting in general, going from paper charts to electronic charts, for us, that's helpful because we can at least see, okay, what's the productivity levels of our providers as well? How can we improve documentation? These paper sheets can be kind of hard to track and, assess from time to time, but having that electronic system is really going to enhance the delivery of care and improve the practice. Data is everything, I think, when it comes to healthcare and specifically in anesthesia. I mean, we think about the quality data that we collect for all of our sites. I, off the top of my head, can't even think of how many metrics we have, but it's at least 20, right, due to patient outcomes. So that helps drive patients' experience. And that's so important in anesthesia because it can be a very challenging specialty to navigate so many different, types of patients and health history and all of those things. I mean, that's the most important driver of our success. And it ensures our clinicians are practicing safe medicine, and it does protect them as well.
How can hospitals measure the return on investment in anesthesia practice improvement initiatives?
Well, I mean, I think it doesn't go back to the patient experience. I mean, the return on investment, if you have a good team of anesthesia providers providing good care, your patients are going to come back for their other knee surgery, right? They had a good experience with the first one, and obviously the same surgeon, they enjoyed the surgeon as well, but their recovery time was decreased. They were up and walking in no time. I mean, that's a direct impact to the hospital and a good review for them.